if one set of resources were adequate for solving this problem, we could have said, oh, let's bring in philanthropic funding and end of the problem, or let government put in all the money, end of the problem. But that's not the case. It takes a multi-pronged approach to really address this issue. As we said, even in our own model, while we get the government support, while we get some of the infrastructure support from the government, and we get the philanthropic support to actually set up our water stations, we also make sure that the community pays a nominal amount to actually secure the water, because that's what builds in the sustainability, and that's where the market-based solution comes in. And if you think about it, yes, there are some people in the world who can absolutely not even pay the few cents needed for this, but most people can afford it. But if you think about the cost benefit of it, Travis, even by spending $7 to $10 a month, they get all the clean water that they need for cooking and drinking. And think about the saved healthcare cost. Think about not losing work days and pay. Think about children staying in school. If you think about the cost benefit, it's really worth having these market-based solutions, because that's what ensures sustainability. This is a global problem. It's not an India problem or a Ghana problem or a Mexico problem or a Brazil problem, right? There are underserved pockets of the countries wherever you look at, you can even call them as safe water deserts, literally, right? Even in the United States, we have certain urban areas, we have native communities and so on that we have been reading in the media and so on as to how these areas are deprived of safe and easy access to water and affordable access to water. So when you work in a resource-challenged context like India and Ghana, where you find lots of creative people and creative solutions, they are replicable solutions, they are transferable solutions, and we must remember that we definitely need to adapt these solutions. There is no one size fits all here. But having said that, when you look at some models and some approaches and innovations that have worked in where we are working in India and Ghana, they are definitely replicable in the United States and in other parts of the world.